like I've always said in every show, we do a thorough history and physical, and once we make a diagnosis, I have to look at those modifiable factors. And from there, it's diet modification, exercise, and weight reduction. For each patient, I tailor my treatment plan. I need to first diagnose if it's type 1 or type 2 diabetes, and then I have to determine what type of medical or medicine, the type of protocol, and the regimen I'm going to use.
Right. Ms. Hart, you help in preparing the clients for the treatments, am I correct?
Yes.
Very good, and that's an important role.
Very important.
To see that they take those treatments. Okay, we are really running out of time. And how do we measure long-term control diabetes? And then we're going to, you have a call? Okay, you're on the line.
Hello?
Yes, go right ahead.
Yes. I would like to know, what is a diabetic coma?
A diabetic coma is when the blood sugar either could be very low or extremely high, and we don't have enough insulin driving it into the tissues. And what happens is let's say if it's the blood sugar is extremely low, you will go into a coma where you basically have a syncopal spell, and you faint, and you go into a like we say coma where you're not conscious anymore. You become unconscious. And that's, yes.
Okay. The next caller. Your next call.
Thank you.
Okay, you're welcome. Oh, I'm sorry, I didn't know you were still there. You're welcome. Okay, the next call. You're on the line. Okay, how do we measure long-term control diabetes?
Okay, diabetes is measured using a hemoglobin A1C, and this measures blood sugar control over a period of three months.
You're on the line. Go right ahead. Okay. I'm sorry. Sorry to cut you off. You said you mentioned 3 months?
Yes. Well, we do a finger stick, and that tells us the instant what the blood sugar is right now. But I want to know how tight controlled the person's sugar's been over a 3-month period. And that's why we order a hemoglobin A1C. And that's a marker, and that's what I use. The key here is to get that hemoglobin A1C down in the 6 range. And when the hemoglobin A1C is in the 6 range, we're going to decrease those risk factors, specifically the micro and macrovascular events. And that's the goal. We want to reduce the sequelae, the side effects, and improve quality of life.
Very good. Ms. Hart, how do you prepare the patients for Dr. O'Brien?
Okay, well, when the patient presents themselves to the clinic, I want to make sure I get exactly why they're there. And I want to get a finger stick immediately before I even go present the patient to Dr. O'Brien.
Okay. So, and then you schedule their appointments?
Yes,
Is that important?
Follow-up is extremely important, especially when you're trying to make sure a patient gets better and make sure they're improving.
Because some people, you know, they go to the doctor once and they say, "Oh, I'm okay, so I don't have to I don't have to keep that next appointment." But, okay, you're online. Go right ahead.
Hello?
Yes, go right ahead.
Yes. I want to know. I have diabetes now for like, I think it's 20 years. And my sugar, when I test it in the morning, it's like 247 and things like that. How could I control it?
That's a good question. Right there, based on your numbers, your blood sugar is elevated. What we need to do is you'd have to go in and sit down and become educated and discuss your labs, your values, your diary with your physician, because it sounds like you need to adjust your levels.
Now,
that's your insulin levels that I'm talking about, the amount of insulin that you're injecting.
Could that be, if they're given some guidance with eating the right food or not eating certain foods, would that help?
Yes, that will as well. That's part of the diet modification and the exercise, because it's a 3-tier approach. It's the education, it's the medications, as well as the appropriate level and amount of medication, in this case, insulin.
Okay, thank you very much. The next caller, go right ahead. You're online, go right ahead. You know, a lot of people maybe haven't realized that it's the food they're eating that creates the problem. You know, not so much that it's just coming on them, but food they're eating. Can you just talk a little bit about that, nutrition?
Yes. Unfortunately, the American diet is high in fat, high in carbohydrates, and the stress, the pressure, the peer pressure. Every block has a McDonald's, a Burger King, these fast food restaurants. It's a lot easier to go to a restaurant to have someone prepare these foods instead of going home and preparing your own foods, taking the time, and actually counting calories. That takes a lot of knowledge, time, energy.
Okay, you're online. Go right ahead. You're on the line. Go right ahead. Yeah, Mrs. Grant. Now, sometimes patients will come in and they're quite disturbed. They have a reading like our sister here, 200 and something, and they leave. Sometimes you see them come out of the doctor's office and they're pretty down. What do you do to help?
Okay, one of my responsibilities is to support the patient. That could be physically and as well as emotionally. So before the patient leaves, I want to make sure that they're relaxed and they understand exactly what's going on and that they will improve.
Does that have anything to do directly with the results of the treatment or their success or how they take the medication?
Exactly. It's very important for patients to be compliant, which means following the doctor's instructions exactly.
Do you take, okay, you're online. Go right ahead. You're on the line. Okay. Continue to call, folks. We're going to continue to take your calls even if we're off the air because we want you to get an answer. The Word of God says, above all, get an understanding. But it also says, seek knowledge. Seek it out. And above all, get an understanding. And that's what we're doing right here, bringing you knowledge. Ms. Grant, you're also a health educator. What do you do?
Okay, I teach a medical assisting program as well as I'm a certified CPR instructor. I teach CPR in the community.
Yeah, in other words, if I need you to come to my church and teach my people CPR, would you be willing to do that?
Of course I would.
You're willing, you're available for other organizations too?
Yes, I am.
Great, okay. All right, somebody's out there saying, I'm going to call Mrs. Grant. And I said Miss Grant, didn't I? All right, so we won't even go into that, but we thank God that you're here and a service to the people, and I know that you are certainly an enticement for men to come in and get their diabetes checked, and maybe that's where I'm going. Okay, we also, Dr. O'Brien, we want to come back to the problem of diabetes because it's important. Whatever it takes, even Mrs. Grant, to get people to come in and get tested, that's all right, isn't it? It's better for them, if that does the testing to save their lives or save a limb, then we would do anything for that. Am I correct?
That's correct. Well, we're wrapping this up. I'd just like to say that everyone should go in for an annual history and physical, and then that's what we do a screening process to see how things are going.
Okay.
Very important.
Well, we want to thank you for being with us, and I hope that this information has improved your lifestyle. God bless you.